Because I'm a pediatrician, I always focus on children's health. This is a picture that was taken, I believe, in a migrant farm camp in California. It shows a couple little boys bathing in a barrel, but if you have keen eyes, you'll see that stenciled on the front of the barrel, 55-gallon drum, are the words tox meth, which doesn't spell vitamin D. Presumably this was a pesticide drum in a previous life. It's been recycled now. Hopefully it's pesticide-free and is full of bathing water, but it certainly makes the point that children in today's world are surrounded by toxic chemicals. There's lots of kids in the world today. The world population today is 6.8 billion. By the year 2050, it will be 9 billion. And of today's 6.8, 2.2, or just about a third, are children. What's striking is that of the 2.2 billion children that live in the world, 2.0 billion are in the developing world. So there's only 200 million children in all the developed countries of the world, but there's 2 billion children in the low and middle income countries of the world. So the societies like ours, Western Europe, Japan, are rapidly graying, as you can see if you look at me. But elsewhere in the world, the mean age of populations is 16, 18, 21, low numbers like that, and continuing to grow. So let me give you some case studies of the export of hazardous chemicals to other countries, and in virtually every one of these instances, it's children who bore the brunt of the adverse effect. The first one was a case study in the export of banned pesticides, an episode of parathion poisoning in Jamaica, which I'll trace out for you in a few minutes. Those of you who are here this morning, if you'll recall back to Dr. Lou Goldfrank's talk, parathion is something that he mentioned. It's a very toxic pesticide in the organophosphate family, so toxic that it's been banned in a number of countries around the world, and Dr. Goldfrank was making the point that it's probably too toxic to be handled in almost any country, and certainly shouldn't be handled in low-resource countries where there are not intensive care units and emergency ambulances with atropine within a 3-mile radius of anybody in the country. Jamaica certainly doesn't fall into that category. Second case study is one of the export of a banned industry, an industry that became unpalatable in the U.S., was disassembled, put on a freighter, and taken to Nicaragua, where it resulted in mercury poisoning. And the third is a current story, very much with us today and still growing, which is the export of e-waste from countries such as ours in Western Europe to low-resource countries. And as I said a minute ago, the two populations that are typically at greatest risk are children and workers, who all too often, in fact, in low-resource countries, turn out to be the same people. Child laborers doing things, for example, as picking over the waste piles of old discarded computers to pick out the lead and the cadmium so that they can recapture it and sell it. Okay, so let's start with banned pesticides. There's a very significant fraction of the pesticides that are produced each year in this country are pesticides that we are not allowed to use in this country, but that we gladly ship to countries that don't have sufficient amounts of toxins so that they can use them. And for example, in the first years of this decade, we exported 1.7 billion pounds of pesticide products per year, pesticides that, the total number of pesticides, and then included in those were 27 million pounds of banned pesticides. Anybody from the Chesapeake Bay area in the room who grew up in Maryland or Northern Virginia? About 20 years ago, there was a famous episode down there where a pesticide called Kepone escaped from a small factory in Virginia into an estuary of the James River called Berry's Creek, and poisoned one whole part of the Chesapeake Bay shellfish industry for 20 years, rendered about 20 workers permanently neurologically damaged and sexually impotent. The pesticide Kepone that they were making in that plant was a pesticide that had long since been outlawed here, but was manufactured in Virginia for export to Central America to be put on the banana crop. Case in point. Among the banned pesticides that are sent overseas are substantial quantities of pesticides that have capacity to disrupt endocrine function. Now, there's an international treaty that's supposed to do something about the movement in international trade of toxic materials, pesticides, and other chemicals, and so-called Annex 3 of the Rotterdam Treaty actually lists the chemicals that are banned from international shipment. Actually, they're not exactly banned, but before country A, let's say the United States, exports a chemical that's listed on this annex to country B, let's call it Malawi, the U.S. is supposed to inform the recipient country about the nasty material that we're sending to them, and more often than not, the provision of that information, which is called prior informed consent, results in the recipient country saying, no thanks. A few years ago, Barry and I were, and many other colleagues, were involved in a struggle to have asbestos listed in this annex to the Rotterdam Convention, and we were beat back by the forces of darkness. So asbestos is not, at the present time, listed as among the banned chemicals on the Rotterdam Convention. Perhaps that will change the next time the Rotterdam Convention meets. They meet every 3 years or 4 years or something to review this list. So at the present time, asbestos is not on there, but a number of pesticides that you can see from the left side of the screen are listed. Senator Patrick Leahy of Vermont, who has long been interested in agricultural issues, I don't know if he coined the phrase, but he certainly made famous the phrase, the circle of poison. This is the notion that every month pesticides that are banned here are shipped overseas, sprayed on crops, put people overseas at risk, and then come back to us on our tomatoes, our bananas, our cut flowers, hence completing the circle of poison. So there's both altruism, morality, but also self-interest involved in this set of issues. Now here's the Jamaica parathion episode. This is not a new episode. This took place in 1976, but I tell the story because I was personally involved in investigating it when I was a young epidemiologist at CDC in Atlanta. And what happened was that in the winter of 1976, there were 3 outbreaks of acute illness, which turned out to be pesticide poisoning, in these 3 towns in southeastern Jamaica, where we put the bright yellow circles on the map. The first was in Bull Bay, the second was in Dalby, and the third and most serious was in the town of Yalis. And what happened in each of those places was that people fell ill, and they developed a clinical syndrome that began with excessive salivation, tearing from the eyes, nausea, vomiting, abdominal cramping, diarrhea, muscle fasciculations, which means uncontrollable shaking of the muscles, and the most severe cases went on to coma, convulsions, respiratory collapse, and death. There were a total of 79 cases of illness that fulfilled our criteria, the definition that we set up to define a case, and of those 79 people who took 17 died. The 3 outbreaks were spread over about a 2-week period. It was about 5 days between Bull Bay and Dalby, and then a pause for about 10 days, and then the Yalis outbreak came along, which was the most severe. And at that point, the Ministry of Health, who already had some suspicions as to the cause, shut down certain food supplies in the country. I'll give you the details in a minute, and called in our group from the CDC in Atlanta to help them do the investigation. So we did what CDC epidemiologists always do. You start by building a list of cases and plotting them on a map, which I just showed you in the previous slide, and then also plotting them on a time chart so you can see the time course of the epidemic. This often reveals a great deal about the nature of the beast and helps you to identify the cause. So here was the first episode. We had about 40 cases, but only 3 deaths. The second one had about 16 or so, 15, 16 cases, no deaths. And then finally this terrible outbreak in Yalis, about 20 cases and a dozen deaths. And that was made it clear to everybody in the little country of Jamaica that they had a terrible problem on their hands. So we came in and we worked with the local Ministry of Health, who were very, very skilled, and helped to develop this information. We categorized cases as mild, moderate, severe, and fatal. We had definitions of those. And we also took blood samples and urine samples from patients to confirm the cases. There are blood tests that you can do to confirm the presence of an organophosphate pesticide. There are urine tests you can do to measure the metabolites in the urine. And so we knew very, very quickly that the highly toxic organophosphate pesticide parathion was the culprit. There was really very little debate about that. The symptoms were classical. The question was, where was it coming from? And so when you want to know the answer to that, you start by asking the families of the people who become sick. And what they told us, each one, was that illness would occur within 10 to 15 minutes of a meal. So it was clear that it was a foodborne outbreak. And we therefore did what CDC does so well. We developed what's called a food frequency questionnaire. It was a list of about 20 or 25 foods that people in Jamaica commonly eat. Many of these are not foods that you see very often in New York, although probably more now than you used to. Things like plantains, salt cod, dumplings, johnny cakes, jerk chicken, a whole series of Jamaican delicacies. And there was just one delicacy that stood out as being very closely associated with the illness, and this was a little dish called dumplings. And what a dumpling is, if you think of the little piece of unleavened bread that your mother used to use to make strawberry shortcake, it's something like that, except a bit smaller. The way people would make it is they would heat up a frying pan, probably put a little oil or grease or something in the frying pan, take a little local flour, a kind of flour called counter flour, mix that with a pinch of salt, a little water to this, slap it down in the frying pan, flip it over, and it's ready in about a minute and a half. It was a great snack or an adjunct to a meal, or if you were a poor person, maybe it was your meal. And it was crystal clear from the results of the food frequency questionnaire that the dumplings were the cause, and indeed the sole cause, of the outbreak. So then we had to ask ourselves, okay, how did these dumplings become contaminated? And so that required going out, talking to people, going to the villages, and doing an on-the-ground boots investigation. And what we learned is that people buy counter flour, which is kind of a low grade of flour, rougher than most of the stuff you can purchase in this country. And they buy it in local stores like bodegas, and typically the person from the family will go to the store and ask the shopkeeper for either a pound or a half pound of the flour. And then the way they would be served out is that the shopkeeper had a scoop that was pre-measured, either in the 1 pound or the half pound size, and he would scoop into a 100-pound bag of flour that would be sitting by the counter. He'd pick it up and he'd dump it into a bag, and they'd take it home and make the dumplings. So we went to the stores in these 3 villages, and we inspected the bags of counter flour that were there. And in Yalis, the town that was the most heavily affected, on the bag was a big yellow stain. The bag was made out of a permeable sort of a burlap material, so easily penetrable by outside liquid agents. There was a big yellow stain on the bag. It had a very acrid smell, reminiscent of garlic. We took samples of the flour right beneath the stain, sent it by Air Express to the CDC labs in Atlanta, and within 24 hours we got back a result that there was a sky-high level of parathion in the flour. And then we took samples from the other shops as well, and there was parathion in them too, but at lower levels, and it was probably the difference in level between the 2 towns that explained the higher case fatality ratio in that town. We also established a dose-response relationship between the number of dumplings that a person consumed and the severity of illness. The average fatality ate 1.5 of these things. The people with mild to moderate illness had about 3/4 of a dumpling, and the people that didn't get sick didn't eat dumplings. It was pretty crystal clear. So the question was, how did this stuff get contaminated? And it was particularly puzzling because parathion was banned in Jamaica. It was not permitted to be used as an insecticide there because there had been poisonings a decade earlier and the government had taken intelligent action and banned the product. So the question is, where was it coming from? So what we did, this is, okay, it works, good. Thank you, Elena, who made these slides. We went to the shops in the towns, and we opened bags in the shops and traced where people got their flour. And then it turned out that the flour had come out to these shops on trucks from the docks in Kingston. The flour was imported from Germany, and the Germans, being very precise, had a 14-digit number on every one of the 5,264 bags in this lot. And it became very clear to us as the investigation proceeded that only flour that was associated with this particular lot was involved in the contamination. There were other lots floating around the country. None of them were associated with any disease. It was just this one lot. So then it became incumbent on us to trace the movement of this lot through Jamaica. And the stuff came in ships from Europe. It was unloaded, as you can see here, under very primitive circumstances. This was not container ships, quite the opposite. It was stored in pretty primitive circumstances on the docks in Kingston, and then it was taken out in trucks, small trucks, through the countryside and dropped off at the stores. So our initial hypothesis was that when we looked at this operation, we figured we'd find something on the docks in Kingston. However, facts are stubborn things, and we learned as the investigation unraveled that there were actually two different companies that carried the bags from the ship out to the countryside, and the two sets of bags were separated virtually the minute they came off the ship, so that the bags that went to Dalve never spent any time in the Kingston terminals with the bags that went out to the other towns. And so unless something had happened with warp speed as the pallets were being offloaded from the freighter, there seemed little likelihood that the contamination could have occurred in Jamaica. And therefore we had to dig deeper. And we found that the 5,264 bags of this lion's head flour had come on the motor vessel Heidelberg from Hamburg, Germany. We painstakingly went through the manifests of every single item that had been on that long sea voyage. We pulled the manifests apart. We even seized two cars, two Mercedes that had been stored in the hold near the flour to see if anybody had secreted parathion in the trunks of the cars. But at the end of the day, and a lot of legwork, the ship was clean and we could find nothing there. So then we were forced to fly to Germany to continue the investigation, and we found that the wheat, which was the source of the flour, was grown in North Germany, just below the Danish border in the province of Schleswig-Holstein, and then it was taken down by trucks. It's about an hour or so down to the port of Hamburg, which is an enormous port. I think we've got some pictures of the port here. And there were 5 trucks that carried the flour, owned by 5 different local contractors. We looked at all the manifests of everything that those trucks had carried for the previous month. There was no evidence of parathion. We also visited the flour mill back up there in Schleswig-Holstein where the wheat had been ground to flour. We found that the owner had a small pesticide shop. He did sell parathion, but we could never establish any link between the shop, which was a couple of miles down the road, and the mill. So that was figured as a red herring. We get into the port, and we did our investigations. Here's a picture of the port. Huge operation. Makes the port of Newark look tiny. And here's loading ships. And we went into the warehouse there, and what we found was that this is sort of the social justice part of the story here now, is that in the parts of the warehouse where goods were destined for shipment to other European ports or the United States, everything was squeaky clean and spiffy. and 99% containerized. But in stuff that was destined for third world ports, the flour bags were the same flour bags as we'd seen back in Kingston, side by side with pesticides, with no physical barriers between the two. And then just as we were wandering around, they took us out onto the loading dock. They had a loading dock on one side where a rail came in, and on the other side was the ship. So the stuff came in by rail, went through the warehouse, went off to the ships. There was a train coming in from the former East Germany full of pesticide drums, 2 of which were leaking, spilling liquid pesticide onto the loading dock. And just that moment, a guy went by driving a forklift truck full of bananas and splashed through the pesticide. So did we prove definitively, court of law, that the contamination occurred in the Hamburg warehouse? No. But we certainly had a circumstance that was ripe for having caused the contamination, and over the great protest of the Bundesgesundheitsamt, we wrote that up and got it published in the American Journal of Epidemiology, and it led to some serious revision a couple of years later in the international rules on container shipping of foodstuffs. So it was an important epidemic, but it certainly demonstrated the discrepancy in the way food is handled between developed and developing countries. Well, here's the second case study. This is a story that I was involved in with your old friends Vicente Navarro, Victor Seidel, and Rob McConnell, and it took place in 1979 in Nicaragua. And what happened in that year, that was the year that the Somoza regime, the tyrannical regime, was toppled. I guess they actually were toppled in late '78, but the new government came in and there were a few months of getting organized. And in 1979, an interesting phenomenon was reported to the Ministry of Health of Nicaragua, and that is that when, it's a bit like Gasland except a different material, when people open the tap on their water faucet in Managua, the capital, droplets of liquid mercury would come out. So you couldn't light it on fire, but it was certainly not water. It led to a public health investigation, which didn't take very long because most observers already had a pretty good idea where the mercury was coming from. Where it was coming from, there was a plant owned by a company called Penwalt, which is based in Philadelphia, which is a plant that would drill down into the ground over a brine pool, just as Dow Chemical sits over an enormous brine pool in the state of Michigan. They had discovered a brine pool in Nicaragua, and they were drilling down into this brine pool to bring up the sodium chloride. And then they used a catalytic operation that involved mercury as a catalyst to separate the chloride from the sodium so that you had pure chlorine gas that could be used to manufacture things like DDT. And on the other side of the plant, you had pure sodium that could be put to various industrial uses. So it's the catalytic separation of sodium from chloride. Very basic chemistry, but on a vast scale and in a very sloppy operation. The plant had started life in Camden, New Jersey, but when it ran afoul of environmental regulations there, it was disassembled, put on freighters, taken to Nicaragua, reassembled, and went to work. It turned out that in the preceding 10 years, as best as anybody could estimate, the plant had discharged 40 tons of liquid mercury into Lake Managua. And that's not good, because first of all, it makes mercury globules come out your faucet, but much more insidious, some fraction of that metallic mercury is transformed by the microorganisms who live in the sediments into a very toxic chemical, a chemical much more toxic than metallic mercury, methyl mercury. It's an organic form of mercury. It becomes methylated. That makes it highly fat soluble and extremely neurotoxic, and it's since been shown that even very small doses of methyl mercury, if exposure takes place prenatally, can cause toxic brain injury in the human fetus with loss of IQ, disruption of behavior. We didn't really focus our investigation on that part of the thing, but we did go into the plant, or I should say my colleagues did, I wasn't physically down there, and they did some air sampling, and they found that air mercury levels in this plant. The amount of mercury that could be measured in a liter of air was 600 micrograms per cubic meter of air, which is 6 times the US standard of that era, which was 100. That was despite the fact that this was an open plant without sides. It had a roof over it to protect against the tropical rains, but no sides, so that there was natural ventilation through. And yet, despite that design, which would seem to be a beneficent thing, there was a shockingly high level of mercury. There were also visible puddles of liquid mercury on the floor of the plant and in other areas. They did physical examinations of the workers, and there were 152 workers there. Of the 152, 56, which is about a third, had obvious mercury poisoning with shakes, with psychological disturbances, the full panoply of classic Mad Hatter disease. Those of you who have read Lewis Carroll's Alice in Wonderland and you've read about the Mad Hatter had mercury poisoning, and that's because in Victorian England, liquid mercury, was used to treat felt hats to give them a certain consistency, and the phrase "mad as a hatter." And those are the same symptoms that these people had. So after that, the usual sequence of legal actions, governmental interventions, and the rest of it ensued. I won't bore you with the details. The important point for this discussion here is it illustrates very much, as Barry Castleman's war stories illustrate, the behavior of multinational corporations in basically taking dirty factories from countries where environmental laws have become stricter, where labor laws have become stricter, and simply taking either the whole factory or just taking the technology, moving it to developing countries where they can operate with complete or at least relative impunity. Here's some of the numbers. 40 tons, map of the country, some description of the situation in the plant. Yes, I'd forgotten this last detail, that some of the workers had actually taken little samples of mercury home as toys for their kids. And that was, of course, they would never have done that if they'd known the hazard, but nobody had told them of the hazard. All right, my third and final example is that of e-waste, which I think you all know what it is, but in case anybody doesn't, this is electronic waste. It's the computer that you threw out last year, the keyboard, the mouse, the cell phone, the TV, anything that has electronics in it that becomes obsolete, which happens, about every 3 years, maybe every 18 months if you're a teenager. Stuff gets tossed. Ever wonder where it goes? Most people probably don't know. There's not much recycling of e-waste in this country. There are a few locations, of course, the usual places, Eugene, Oregon, Seattle, Washington, probably a few other enlightened cities that recycle e-waste. But in a lot of cities, it's not very vigorously pursued. It constitutes 3 to 4% now of the solid waste stream in the USA, and it's increasing by about a percentage point a year. And it's not just in the US either, because of course one of the things that we're seeing in the Middle East these days with everybody communicating by cell phones is that electronic toys are propagating worldwide, and therefore e-waste will follow from countries around the world. And it's anticipated that in 20 years the developing countries will be discarding 500 million personal computers each year. We're throwing out more, of course, because we're richer. A couple of 300 million a year. Today, these are the producers with the blue signs: U.S., Europe, India, Australia, China, and then the recipients, the little circles, which, as you can see, tend to be poor countries. Southeast Asia was left off that, but I myself have seen huge piles of e-waste in Cambodia with little kids picking over it. And what happens is this stuff gets loaded on ships, taken to these places, put into huge dumps where women, children pick through the e-waste to recover wires, circuit boards, copper, precious metals. And if a poor person goes through enough of this stuff in the course of a day, they can make a daily wage. but of course at a cost because of the pollutants that are in there. So here are some of the materials that comprise e-waste. It's monitors, DVDs, refrigerators, washing machines. You don't think of them as being e-waste, but of course they all have chips and circuit boards today. And on the left side is a list of the pollutants. It looks eerily similar to the list that Richard Fuller showed in his first slide this morning, even in the order of the chemicals, although we didn't collude in the production of our slides. And then the middle column lists some of the toxicologic mechanisms by which these various pollutants act in the human body to cause disease, everything from oxidative stress to alteration of the nervous system to disruption of endocrine signaling. And then finally, over on the right-hand side, focusing on the nervous system, although we could have looked at the lungs or the immune system or the reproductive organs. But in this particular slide, we're looking at the nervous system. And the upper half of the right-hand column indicates all the different points where these pollutants have negative impacts in the nervous system, and the proliferation and migration of neurons, the formation of synapses, the connections between the cells, the myelinization, which is the coating of the axons. Between them, these chemicals can wipe out virtually any formative process in the nervous system to produce the range of negative outcomes that are listed in the pink box at the lower right. Loss of IQ, impairment of cognition, impulsive behavior, not things that you want your child to have if you want your child to go to Yale. And yet, this is stuff that we're inflicting upon countries around the world. And a clear example of international inequity. So with that, I thank you. This is not pretty stuff. The solutions are going to be complex. The mechanisms are clearly going to need to be multinational. Through multinational mechanisms such as the Rotterdam Convention, the Basel Convention, which forbids the movement of certain forms of hazardous waste in international commerce, and control over these inequitable practices will not be achieved until countries around the world, and most importantly this country, we are after all still the most powerful country in the world, if we do not take a leadership role in encouraging other countries to sign these conventions, then many countries will be persuaded that they can get away with inaction, and that's what's happening now. I think the time has come in matters such as these, at least, to get away from American exceptionalism, embrace internationalism, and realize that we have to pull together with brother and sister countries around the world to control these hazards. And at the end of the day, it's about protecting people like this little guy here. So thank you very much.